Question 1. You're a technician working in an animal research facility and one of the animals in your care shows signs of illness. The animal is lethargic, not eating, and has abnormal stool. You suspect it may be suffering from a gastrointestinal disorder. What is the first step you should take to assess and manage this situation? Administer an antibiotic immediately to prevent infection. Isolate the animal to prevent potential spread and notify the senior veterinarian. C. Continue monitoring the animal and wait to see if the symptoms improve over time. D. Provide the animal with fluids and food, then observe its response. Answer. B. Isolate the animal to prevent potential spread and notify the senior veterinarian. Explanation. When dealing with a sick animal in a research setting, it's crucial to prioritize safety and control potential disease transmission. Isolating the animal helps reduce the risk of spreading the illness to other animals. Notifying the senior veterinarian is necessary to assess the condition properly and determine the correct course of action. Immediate administration of antibiotics, option A, without a proper diagnosis can be detrimental as it may cause resistance or further harm. Option C, continuing to monitor the animal without intervention, is insufficient in a situation where the symptoms are concerning. Option D, offering fluids and food, may provide temporary comfort but does not address the need for immediate veterinary intervention. Question 2. Which of the following best describes the primary purpose of enrichment programs for animals in care facilities? A. To promote rapid growth and increase productivity in farm animals. B. To reduce stress and enhance the overall well-being of the animals. C. To comply with regulatory requirements for animal housing. D. To maintain strict control over animal behavior for research purposes. Answer. B. To reduce stress and enhance the overall well-being of the animals. Explanation. Enrichment programs are designed to improve the mental, physical, and emotional well-being of animals in care. These programs are based on providing animals with stimulating environments that mimic natural conditions, which helps to reduce stress, prevent boredom, and encourage natural behaviors. While regulatory compliance, option C, is important is specifically focused on the welfare of the animal, not merely meeting minimum legal standards. Promoting rapid growth, option A, is typically associated with agricultural practices, not enrichment, and controlling behavior for research, option D, is contrary to the principles of enrichment, which aim to improve animal welfare rather than restrict it. Question 3, scenario question. Mr. Roberts is an animal technician working in a wildlife rehabilitation center. He is presented with a wild bird that appears to have a broken wing. The bird is stressed and agitated, showing signs of aggression. As Mr. Roberts attempts to assess its condition, he needs to restrain the bird to stabilize its injury, but he is concerned about causing further distress or injury. What should Mr. Roberts do to ensure safety of both the animal and himself while properly restraining the bird? A. Use a net to capture the bird immediately and hold it firmly to prevent any movement. B. Place a towel over the bird's head to calm it down before gently restraining it with one hand. C. Attempt to handle the bird with bare hands as quickly as possible to minimize time under stress. D. Call in veterinarian to perform the restraint, as it is too dangerous for Mr. Roberts to handle. Answer. B. Place a towel over the bird's head to calm it down before gently restraining it with one hand. Explanation. In the case of restraining wild or stressed animals, it is essential to prioritize safety for both the handler and the animal. Option B is correct because covering the bird's head with towel can calm it down, reducing its agitation and making it easier to handle with minimal risk of further injury. Gently restraining the bird ensures that it is stabilized without causing additional stress or harm. Using net, option A, may be effective in capturing the bird, but it could further stress the animal and potentially worsen its injury. Handling the bird without proper precautions, option C, increase the risk of injury to both the technician and the animal. Calling veterinarian, option D, may be necessary if Mr. Roberts is unsure of the bird's condition, but basic restraint can often be performed safely by trained technicians. Question 4. Which of the following is the most critical factor when designing animal housing for long-term care in a research facility? A. Maximizing space to accommodate as many animals as possible. B. Ensuring proper environmental controls, such as temperature, lighting, and ventilation. C. Using expensive, high-tech equipment to monitor animal behavior. D. Providing minimal interaction with staff to reduce stress on animals. Answer. B. Ensuring proper environmental controls, such as temperature, lighting, and ventilation. Explanation. Proper environmental controls are essential to ensure that animals are kept in conditions that meet their physiological and behavioral needs. This includes maintaining appropriate temperature, humidity, light cycles, and ventilation to promote health and reduce stress, while maximizing space. Option A may be important, it should not come at the cost of ensuring the animal's comfort and well-being. High-tech equipment, option C, can support monitoring but does not replace the need for basic environmental management. Reducing staff interaction, option D, may not be beneficial, as positive human-animal interaction could contribute to the animal's mental stimulation and welfare. Question 5. Which of the following is an example of a best practice for biosecurity in animal research facilities? A. Allowing animals to roam freely in the facility to encourage natural behaviors. B. Regularly cleaning and disinfecting all surfaces and equipment used in animal care. C. Limiting staff involvement in animal care to reduce exposure to animals. D. Using the same equipment for all animal species to avoid unnecessary waste. Answer B. Regularly cleaning and disinfecting all surfaces and equipment used in animal care. Explanation: biosecurity involves measures that are put in place to prevent the spread of infectious diseases in animal research facilities. Regular cleaning and disinfection of all surfaces and equipment, option B, is critical to reduce contamination and the spread of pathogens. Allowing animals to roam freely, option A, can increase the risk of transmission and should be avoided in controlled environments. Limiting staff involvement, option C, may reduce exposure but does not directly contribute to biosecurity. Using the same equipment across species, option D, could increase cross-contamination and is considered poor practice. Question 6. What is the primary reason for keeping accurate and detailed animal health records in an animal care facility? A. To monitor animal performance and productivity. B. To ensure compliance with legal and regulatory requirements. C. To track the financial cost of each animal's care. D. To maintain detailed records for marketing purposes. Answer B. To ensure compliance with legal and regulatory requirements. Explanation: accurate and detailed animal health records are essential for compliance with animal welfare regulations and laws. These records help demonstrate that the facility is meeting the required standards for animal care and management. While tracking performance, option A, and financial costs, option C, may be useful for other aspects of animal management, they are secondary. Legal compliance, marketing purposes, option D, is not a valid reason for maintaining health records, as these records should primarily focus on the welfare and management of the animals. Question 7. Which of the following is a key component of ethical decision-making when working with animals in a care facility? A. Prioritizing the financial cost of animal care over the animal's well-being. B. Ensuring that all procedures conducted on animals have scientific merit and benefit. C. Using animals for research or education without considering their welfare. D. Reducing the number of animals used in research without regard to research objectives. Answer B. Ensuring that all procedures conducted on animals have scientific merit and benefit. Explanation: ethical decision-making in animal care involves considering the animal's welfare and ensuring that any procedures performed on animals are justified by their scientific merit and the potential benefit to society. This is in line with the principles of the 3Rs: replacement, reduction, and refinement, which aim to minimize animal suffering and use. Prioritizing financial cost, option A, is contrary to ethical considerations. Option C is unethical as it disregards the welfare of animals. Option D, reducing animal numbers without regard to research goals, is also problematic as it may compromise the quality and validity of the research. Question 8. What is one of the key responsibilities of an animal technician when assisting in veterinary procedures? A. To perform invasive surgeries independently without supervision. B. To ensure proper sterilization of surgical instruments before and after use. C. To diagnose medical conditions in animals under normal circumstances. D. To administer medications and treatments without consulting the veterinarian. Answer B. To ensure proper sterilization of surgical instruments before and after use. Explanation: one of the primary responsibilities of an animal technician in a veterinary setting is to ensure that all surgical tools and instruments are properly sterilized before and after use to prevent infections and maintain a sterile environment. Performing surgeries, option A, independently is not appropriate unless specifically trained and authorized. Diagnosing medical conditions, option C, is outside the scope of an animal technician's responsibilities, which are more focused on support. Administering medications, option D, should always be done under the guidance and direction of a licensed veterinarian. Question 9. Which of the following is the most effective way to reduce stress for animals during transportation to a new facility? A. Transporting animals in large groups to minimize the number of trips required. B. Ensuring that the transport containers are well ventilated, secure, and provide space for the animals. C. Keeping the transport duration as long as possible to avoid frequent stops. D. Using tranquilizers on animals to keep them calm during transport. Answer: B. Ensuring that the transport containers are well ventilated, secure, and provide space for the animals. Explanation: the key to reducing stress during animal transportation is to ensure that the animals are comfortable and secure. Well-ventilated containers with adequate space help to reduce anxiety and physical stress. Transporting animals in large groups, option A, may increase stress levels as animals are often territorial and may become agitated. Long transport durations, option C, can exacerbate stress, and tranquilizers, option D, may only mask symptoms, potentially causing further health complications. Question 10. Which of the following would be the best practice when handling an injured animal with the broken limb? A. Allow the animal to move freely to assess its natural movement. B. Restrain the animal firmly to prevent any movement of the injured limb. C. Apply pressure directly to the injury to control any bleeding immediately. D. Provide the animal with food and water before any medical intervention. Answer: B. Restrain the animal firmly to prevent any movement of the injured limb. Explanation: in the case of an injured animal, it is crucial to stabilize the injury and prevent further damage to the affected limb. Restraining the animal gently but firmly helps avoid unnecessary movement that could exacerbate the injury. Allowing the animal to move freely, option A, can worsen the injury. Applying direct pressure to the injury, option C, should only be done necessary to stop severe bleeding and should be performed carefully. Providing food and water, option D, is not a priority over addressing the injury and stabilizing the animal for transport to veterinary care. Question 11. When handling wild animals in a rehabilitation facility, what is the most important consideration for reducing stress and injury during handling? A. Ensuring that all wild animals are sedated before handling to minimize resistance. B. Wearing protective clothing and using appropriate restraint techniques to avoid injury to both the animal and handler. C. Handling the animals as infrequently as possible to prevent habituation to humans. D. Using loud noises to calm the animal and make it easier to manage. Answer: B. Wearing protective clothing and using appropriate restraint techniques to avoid injury to both the animal and handler. Explanation: when handling wild animals, it is essential to ensure the safety of both the animal and the handler. Protective clothing, such as gloves, face shields, and protective suits and restraint techniques reduce the risk of injury. Sedating wild animals, option A, should only be done under veterinary guidance and may not all be the best option as it can cause additional stress. Minimizing human interaction, option C, is important, but it should not come at the cost of the animal's health or safety during necessary interventions. Loud noises, option D, are likely to stress the animal further and should be avoided. Question 12. Which of the following is a key ethical consideration when working with animals in a research setting? A. Ensuring that the research has scientific merit and that the potential benefits outweigh the harm caused to the animals. B. Using the maximum number of animals possible to increase the validity of the research findings. C. Performing experiments without informing the research team to avoid bias in results. D. Neglecting to provide the animals with enrichment as long as the research is scientifically valid. Answer A. Ensuring that the research has scientific merit and that the potential benefits outweigh the harm caused to the animals. Explanation: ethical considerations in animal research are guided by the principles of the 3's: replacement, reduction, and refinement. Ensuring that research has scientific merit and that its potential benefits outweigh the harm to animals, option A, is a fundamental ethical requirement. Using the maximum number of animals, option contradicts the principle of reduction, which advocates for minimizing animal use. Performing experiments without team input, option C, can compromise the integrity of the research, and neglecting enrichment, option D, fails to consider the animal's well-being, a key ethical principle in research. Question 13. A veterinary technician notices an animal under their care exhibiting signs of severe distress. The technician is unsure whether the distress is due to an injury, illness, or psychological stress. What should the technician do first? A. Immediately administer pain relief medication to the animal. B. Record the symptoms and wait for the veterinarian to perform an assessment. C. Provide the animal with a tranquilizer to calm it down. D. Report the symptoms to the veterinarian for further evaluation and immediate action. Answer D. Report the symptoms to the veterinarian for further evaluation and immediate action. Explanation. The first priority should always be to report any signs of distress to a veterinarian for a professional evaluation. The veterinarian can determine the cause and recommend appropriate treatment, administering pain relief option A or tranquilizers option C without the veterinarian's guidance could mask important symptoms and lead to incorrect treatment. Recording symptoms option B is part of the process but should not delay action. Immediate reporting to veterinarian is the most appropriate course of action. Question 14. Which of the following is the best way to ensure that animal welfare regulations are consistently followed in a facility? A. Assigning a single employee to monitor animal welfare without involving the rest of the team. B. Conducting regular internal audits to evaluate compliance with animal welfare laws and procedures. C. Allowing employees to make their own decisions about animal welfare as long as they feel confident. D. Providing minimal training to staff about animal welfare standards, assuming they already know the regulations. Answer B. Conducting regular internal audits to evaluate compliance with animal welfare laws and procedures. Explanation. Internal audits are crucial for ensuring that animal welfare regulations are being followed consistently. These audits allow management to identify gaps in compliance and implement corrective actions. Assigning a single employee, option A, is not effective as it isolates responsibility. Allowing employees to make their decisions, option C, undermines standardized procedures and increases the risk of non-compliance. Minimal training, option D, is insufficient as ongoing education and reinforcement of welfare standards are necessary to maintain high standards in animal care. Question 15. Which of the following is the most effective method for preventing the spread of zoonotic diseases in a veterinary clinic? A. Ensuring that all animals are vaccinated before they enter the clinic. B. Using personal protective equipment (PPE) and following hygiene protocols during animal handling. C. Limiting client visits to reduce the risk of disease transmission. D. Providing educational materials to clients about zoonotic diseases without implementing preventive measures in the clinic. Answer B. Using personal protective equipment (PPE) and following hygiene protocols during animal handling. Explanation. The most effective method for preventing the spread of zoonotic diseases in a veterinary clinic is to use appropriate PPE such as gloves, masks, and gowns and follow strict hygiene protocols such as hand washing and disinfecting surfaces. Vaccinating animals, option A, is important but may not prevent zoonotic diseases. Limiting client visits, option C, can reduce exposure but is not a comprehensive solution. Providing educational materials, option D, is valuable but should be paired with direct preventive actions within the clinic, such as PPE use and hygiene practices to effectively control disease transmission. Question 16. In a scenario where a technician is administering injections to an animal under the guidance of a veterinarian, what is the most important factor to ensure that the procedure is safe and effective? A. Ensuring that the animal is restrained properly to prevent sudden movements that could cause injury. B. Using a needle size that is smaller than what is typically required to minimize discomfort. C. Administering the injection as quickly as possible to minimize the animal's stress. D. Performing the injection without checking the animal's medical history to save time. Answer A. Ensuring that the animal is restrained properly to prevent sudden movements that could cause injury. Explanation. Proper restraint is critical during any veterinary procedure to ensure both the safety of the animal and the handler. If an animal is not properly restrained, sudden movements could lead to injury, complications, or improper injection placement. While needle size, option B, is important, it should not be prioritized over restraint. Administering the injection too quickly, option C, may increase stress or cause discomfort, and skipping medical history, option D, could overlook important contraindications or medical concerns, leading to risks. Question 17. When selecting an appropriate method of animal restraint, which factors should be prioritized to minimize stress and injury to the animal? The size and species of the animal being handled. B. The financial cost of restraint equipment. C. The duration of the procedure. D. The availability of staff to assist during the restraint. Answer A. The size and species of the animal being handled. Explanation. The most important factor when selecting a method of restraint is the size and species of the animal. Different species require different techniques to minimize stress and prevent injury. For instance, large animals like horses require different methods than small animals like rabbits, while cost, option B, and duration, option C, are practical considerations. They should compromise the animal's welfare. The availability of staff, option D, is important but should not take precedence over the animal's needs during restraint. Question 18. A veterinary technician is performing a routine examination on a dog when they notice signs of a parasitic infection. The technician should immediately A. Begin administering a deworming treatment to the animal. B. Report the findings to the veterinarian for further diagnosis and treatment. C. Ignore the symptoms and continue with the examination. D. Inform the pet owner and suggest over-the-counter treatments. Answer B. Report the findings to the veterinarian for further diagnosis and treatment. Explanation. If a veterinary technician suspects a parasitic infection, they should report it to the veterinarian immediately. The veterinarian will confirm the diagnosis and recommend an appropriate treatment plan. Administering medication without proper diagnosis, option A, could lead to incorrect treatment or harm the animal. Ignoring the symptoms, option C, result in the condition worsening. Suggesting over-the-counter treatments, option D, without professional guidance can be ineffective and potentially harmful. Question 19. A veterinary clinic is preparing to perform surgery on a dog. Which of the following practices is the best way to minimize the risk of surgical site infection? A. Only use a single-use surgical instrument and discard it immediately after the procedure. B. Sterilize all surgical instruments and ensure a sterile field is maintained throughout the surgery. C. Allow the dog to leave the clinic immediately after the surgery without follow-up care. D. Limit the use of antibiotics after the surgery to avoid resistance. Answer B. Sterilize all surgical instruments and ensure a sterile field is maintained throughout the surgery. Explanation. Maintaining a sterile field and sterilizing surgical instruments are essential practices in preventing surgical site infections. This helps ensure that no bacteria or other pathogens are introduced during the procedure. Single-use instruments, option A, can be effective, but sterilization is a more comprehensive and standard. Allowing the dog to leave immediately after surgery, option C, could compromise its recovery. Limiting antibiotics, option D, may be part of an infection control plan, but they should be prescribed based on professional medical judgment. Question 20. In a scenario where an animal's welfare is at risk due to neglect in facility, what is the technician's primary responsibility? A. Continue caring for the animal as best as possible without reporting the issue to authorities. B. Report the situation immediately to the facility manager and relevant authorities to ensure the animal's welfare. C. Ignore the situation as it's not part of the technician's job description to intervene. D. Take the animal home for personal care to prevent further harm. Answer B. Report the situation immediately to the facility manager and relevant authorities to ensure the animal's welfare. Explanation. The technician has an ethical and legal responsibility to report any cases of animal neglect or abuse. This is essential for ensuring the animal's well-being and adhering to animal welfare laws. Continuing to care for the animal without intervention, option A, could be seen as complicity in the neglect. Ignoring the situation, option C, is failure to act, which could lead to further harm. Taking the animal home, option D, is not legal or ethical solution and could be illegal depending on the circumstances. Reporting the issue, option B, is the most appropriate and responsible course of action. Question 21. You're a veterinary technician working with a group of laboratory animals. A new protocol is introduced for an experiment involving a controlled substance. What is your first action to ensure the safety and ethical compliance of this procedure? Administer the substance to the animals immediately as per the protocol. B. Verify the protocol with the supervising veterinarian and ensure all ethical guidelines are followed. C. Ask the lab assistant for advice on the correct dosage of the substance. D. Ignore the new protocol if you feel it is too risky for the animals. Answer B. Verify the protocol with the supervising veterinarian and ensure all ethical guidelines are followed. Explanation. Before proceeding with any procedure involving controlled substances, the first action should be to verify the protocol and ensure all ethical guidelines are followed. This includes obtaining proper approval and understanding the risks to the animals. The supervising veterinarian should be consulted to confirm the appropriate course of Option B. Ministering the substance without verification, Option A, or relying on unverified advice, Option C, can lead to harm or ethical violations. Ignoring the protocol, Option D, is not an acceptable option in animal research or care. Question 22. A veterinary technician is preparing an animal for surgery. Which of the following steps should be taken to ensure the procedure complies with infection control protocols? A. The animal should be fasted for 24 hours before the surgery. B. The surgical area should be cleaned and disinfected with a non-sterile solution. C. The technician should wear sterile gloves and prepare a sterile field. D. The animal should be housed in a recovery cage immediately after the surgery without further observation. Answer. C. The technician should wear sterile gloves and prepare a sterile field. Explanation. Infection control protocols are critical for ensuring the safety of both the animal and the staff during surgery. The technician must wear sterile gloves and prepare a sterile field to prevent contamination. Option C. Fasting the animal for 24 hours. Option A is typically done to prevent aspiration during surgery but is not directly related to control. Non-sterile cleaning solutions, Option B, should not be used in surgery preparation as they do not maintain the sterile environment required for infection prevention. Post-surgical housing, Option D, may involve monitoring, but it does not address infection control during the procedure. Question 23. In a situation where an animal is showing signs of severe distress and pain, but the veterinarian is not immediately available, what should the veterinary technician do to manage the situation? A. Wait for the veterinarian to arrive, as the technician cannot make medical decisions. B. Administer pain relief medication as per the technician's discretion, even if it's outside their usual duties. C. Document the symptoms and contact the veterinarian for advice on how to proceed. D. Attempt to calm the animal by interacting with it until the veterinarian arrives, but avoid medical intervention. Answer. C. Document the symptoms and contact the veterinarian for advice on how to proceed. Explanation. The technician should immediately document the symptoms of distress and contact the veterinarian for advice. Option C. A veterinary technician must work within their scope of practice and cannot make medical decisions that go beyond their training and authority. Administering medication without veterinary guidance, Option B, could lead to legal and ethical violations. Waiting without taking any action, Option A, could cause unnecessary suffering to the animal. While calming the animal, Option D, is beneficial, it does not address the need for immediate veterinary intervention in the case of severe pain or distress. Question 24. Which of the following factors is most important when creating a balanced diet for an animal in a zoo environment? A. The age and reproductive status of the animal. B. The financial cost of the diet plan. C. The type of food the animal is most familiar with, based on its wild diet. D. The availability of food items in the local area regardless of species-specific needs. Answer A. The age and reproductive status of the animal. Explanation. When creating a balanced diet for animals in a zoo environment, the most important factor is ensuring the nutritional needs specific to the age and reproductive status of the animal are met. Option A. These factors significantly impact the animal's health and development. The financial cost of the diet plan, Option B, and the availability of local food, Option D, are concerns but should never override the nutritional needs of the animal, while familiarity with the wild diet, Option C, can provide useful insights. It is not the most important consideration when designing a diet plan that supports the animal's specific needs in captivity. Question 25. A veterinary technician is assisting in a research study involving the administration of a vaccine to several animals. Which action should be prioritized to ensure the study complies with ethical standards? They ensure all animals are treated as humanely as possible, even if the study requires invasive procedures. Only administer the vaccine if it has already been approved by the proper regulatory bodies. C. Collect detailed data on the animal's behavior before and after the vaccine administration. D. Document any issues that arise during the study, but only report them to the research team. Answer B. Only administer the vaccine if it has already been approved by the proper regulatory bodies. Explanation. Ethical standards in animal research require that all procedures, including the administration of vaccines, are approved by the relevant regulatory bodies before they are carried out. This ensures that the study complies with animal welfare laws and ethical guidelines. Option B, while humane treatment, option A, is important. It should be a part broader ethical framework. Collecting data on behavior, option C, and documenting issues, option D, are important for study integrity, but they do not supersede the necessity of regulatory approval. Only approved procedures should be conducted to avoid legal and ethical violations. Question 26. In a situation where a researcher is conducting an experiment involving animals and there is an unexpected adverse reaction to a medication administered to the animals, what is the most appropriate course of action? A. Immediately stop the experiment and report the issue to the ethics committee. B. Continue the experiment as planned and address the adverse reaction after the procedure. C. Document the incident and inform the senior researcher at the end of the day. D. Administer more medication to counteract the adverse reaction. Answer A. Immediately stop the experiment and report the issue to the ethics committee. Explanation: the ethical and legal responsibility of any animal research is to ensure the well-being of the animals involved. In the event of an adverse reaction, the researcher must immediately stop the experiment and report the incident to the ethics committee. Option A. This ensures that the situation is addressed promptly and any necessary adjustments to the protocol are made. Continuing the experiment, option B, could lead to further harm to the animals and may result in legal and ethical consequences. Documenting the incident without taking immediate action, option C, would be inappropriate as it fails to prioritize the animal's welfare. Administering more medication, option D, without proper veterinary guidance may exacerbate the situation. Question 27. A technician is tasked with setting up a cage for an exotic animal species that requires specific temperature and humidity conditions. Which of the following should be prioritized to ensure the animal's welfare in its environment? A. The technician should use a thermostat to control the temperature and manually monitor humidity. B. The technician should rely solely on the animal's natural behavior to regulate the environment. C. The technician should use automated systems that control both temperature and humidity and verify their accuracy regularly. D. The technician should allow the animal to adjust to the environment on its own over time. Answer: C. The technician should use automated systems that control both temperature and humidity and verify their accuracy regularly. Explanation: to ensure the welfare of exotic animals, it is essential to use automated systems that can consistently regulate both temperature and humidity within the specific ranges required for that species. Option C. Regular verification of these systems ensures accuracy and prevents potential issues. Solely on natural behavior, option B, is not adequate as the animal may not be able to regulate its environment effectively in captivity. Manual monitoring, option A, can be prone to error and solely relying on the animal's adjustment. Option D can be detrimental to its health and welfare. Question 28. In a scenario where you are handling an aggressive dog in a clinic, what is the best approach to ensure both your safety and the safety of the animal? A. Attempt to calm the dog by speaking to it in a soft voice and using treats to distract it. B. Use a muzzle to prevent the dog from biting and ensure the animal is restrained during the examination. C. Leave the dog in the examination room without handling it until the veterinarian arrives. D. Approach the dog immediately and try to restrain it using a leash and collar without waiting for help. Answer B. Use a muzzle to prevent the dog from biting and ensure the animal is restrained during the examination. Explanation: in the case of an aggressive dog, the priority is to ensure the safety of both the animal and the handler. Using a muzzle is the most appropriate and safe method to prevent biting during the examination. Option B. It is crucial to avoid direct physical restraint. Option D. Without proper precautions, as this could lead to injury. Speaking to the dog, option A, may calm it in some situations, but is not sufficient for safety in a potentially aggressive situation. Leaving the dog unsupervised, option C, could escalate the risk as the animal may become more agitated. Question 29. A veterinary technician is working with an injured wild animal brought into the clinic. What is the first step in managing the animal to ensure both its safety and compliance with relevant wildlife laws? A. Assess the animal's condition and provide treatment based on the technician's experience with wildlife. B. Immediately contact licensed wildlife rehabilitator for advice and follow local wildlife regulations for handling. C. Place the animal in cage and wait for the veterinarian to return to assess its condition. D. Administer pain relief medications as needed to stabilize the animal before taking further action. Answer: B. Immediately contact a licensed wildlife rehabilitator for advice and follow local wildlife regulations for handling. Explanation: the first step when handling a wild animal is to contact a licensed wildlife rehabilitator or appropriate wildlife authority. Option B. This ensures that the animal is treated in accordance with local wildlife regulations and the technician can follow the appropriate protocols for care. Assessing the independently. Option A without expert guidance could be dangerous for both the animal and the technician. Simply waiting for the veterinarian. Option C without taking initial steps may delay proper care. Administering medications. Option D without proper veterinary advice may not be appropriate due to the species-specific requirements and local laws regarding wildlife treatment. Question 30. You are tasked with monitoring the health of a group of companion animals in a shelter. You observe that one animal is showing signs of weight loss and lethargy. What is the most appropriate course of action? A. Record the symptoms and wait for the animal to recover on its own. B. Immediately isolate the animal from others and provide it with food and water. C. Notify a veterinarian immediately and provide a detailed report on the animal's symptoms. D. Administer nutritional supplements to the animal and monitor its condition until the veterinarian arrives. Answer: C. Notify the veterinarian immediately and provide a detailed report on the animal's symptoms. Explanation: the most appropriate response is to notify the veterinarian immediately and provide a detailed report on the symptoms. Option C. Lethargy and weight loss are signs of illness that need to be addressed promptly to prevent further complications. Simply waiting for the animal to recover on its own. Option A can lead to a worsening condition. Isolating the animal. Option B without first seeking professional advice could lead to the animal's condition worsening without proper treatment. Administering nutritional supplements. Option D may not address the underlying cause of the symptoms and should not be done without veterinary guidance.